Thank you very much, Ms. Suchitra Ella, co-founder of Bharat Biotech, for joining me here on Times Now. India is all set and is holding and hosting the G20 Summit right here. I want to ask you, when you deliberate with people in the pharma world, how are people looking at India? Because you've set your own benchmark as the co-founder of Bharat Biotech, the way you literally got this country out of a huge crisis of the pandemic with the vaccine that was made in India, the Atmanirbhar Bharat demonstration right here in front of the world. How are people now looking at India?
Good evening, Navika. This is a great pleasure to be meeting you here on this world stage when global leaders are going to be present in Bharat, in India. I think these are momentous times for all of us indeed. I was just in Delhi a week ago at the G20 Summit and the gathering, and I just could see, I could feel it, that we were on the top of the world. Kind of, that was the intuition I got, and the time is right for India to leapfrog into the future in terms of the opportunities we have, the challenges we have, the resources we have, and the technologies that we have with us at this point of time, but also the technologies that we need to garner in order to be there for the future as well. At this point of time, I think our position in the world in terms of where we stand as a country in the pharmaceutical, life sciences, biotech sector is something, I think the flag is flying very high for us. When we have people from across the world come visit us, they're looking for partnerships, they're looking for collaborations, they're looking for joint programs, knowledge sharing, and technology building. I think this is the way forward that we need to look at as well and take that position and be there in order to prepare ourselves and also be a part of the global preparedness for the future.
Let me also ask you, Ms. Ella, how do you see India's profile? How has it changed over the last 5 years, 10 years, 15 years? We were seen as an economy that had the potential but had missed the bus many a times. Do you think now when the world looks at India, it looks at India with renewed respect, and what are the reasons that they do that?
Navika, I just would like to mention a small anecdote. When Krishna and I came back to India, this was way back in 1996, India was 50. And today, when I'm here having this conversation with you, we have just crossed the India at 75 mark. And the future that we hold in front of us is the India at 100 that we all envision to go forward to. Back then, I could even relate to 15, 20 years ago, when we talked of technologies like this, there was a lot of doubts, questions, to some extent, skepticism. Are we there as a country? Can we do it? Do we have the resources? Do we have the technological abilities? Do we have the brain power? Because these are all science and technology-driven innovations and technologies that are built on platforms that need to be created for manufacturing. India did have the research and academic capabilities, which was very well being demonstrated in the laboratories and the universities of higher science and higher learning. But did we convert them into applications and commercially viable products, which were affordable and which were completely available for us? That was not happening back then, 5, 10, 15, 20 years ago. But I think today, yes, we have demonstrated that we not only can innovate, we can conduct our own product development research, we can scale the production capabilities to millions, if not billions of doses of vaccines and pharmaceutical products, and we have distributed it not only to our own country and fellow citizens, but we have also sent it across the globe. So I think we have reached that pedestal where we know what our capacities are, our capabilities are, and the scale at which we can operate. And this is not just me talking about vaccines, but the entire pharmaceutical industry. We have a very high reputation in the global circuit of life sciences, where we have one of the largest number of US FDA approved facilities outside of the United States, that is in India. So that goes to show that we are producing, manufacturing products that are of global standards and global guidelines and regulations. Because the pharmaceutical and the life sciences industry, the biotech industry, come under heavy regulation by the national regulatory authorities and also by the international regulatory authorities. So I think we have set ourselves that benchmark, and I think we can go further ahead in this journey.
Of course, we call the pharmacy of the world, and you're right, we have production facilities in India coming up like never before. The question today is the focus so much more on health today because of the pandemic than ever before? We've been fighting with isolated cases of diseases that stay in the developing world and action against it. But today, the spotlight is on health across the globe. Developed countries have seen their soft underbelly, and some countries like India have shown the way literally during these pandemic years. Having said that, how do you see India engaging with the business community abroad? How's the world looking at investments in India? How are summits like the G20 Summit going to benefit us in terms of increasing the investments and overall the growth economically of this country? Because is this the time? Many are asking this question. Is this the time we'll finally get on to that bus that we've missed several times in the past?
Wow, that's one too many questions bundled in together as one huge question. But I will try and see if I can not miss some of those questions that you have raised here. I think it is not just the pandemic. As a country, as a population, health is of course important, and we have always demonstrated that that we were completely serving our own requirements of the country in terms of health, whether it was products, whether it was the services, or whether there was the distribution, which is the largest probably in the world in terms of the demographics that we have. Our birth cohort in India, Navika, is 27 million children. That's the number of children that are born each year. So this is by far the largest birth cohort that exists. And we need to service this. We have been doing it even before the pandemic. But there are certain areas where we could probably definitely have to reach the masses further, the hinterlands, and also the services, especially in the medical systems, in terms of the care and the hygiene, the nutrition, and all those areas. I think there can be definitely areas of improvement. I know the COVAXIN platform that just was brought in at the time of the pandemic has helped enormously in terms of how we went digital. Just from not using it before, and in one stroke, we had this application which somebody could just download and figure out when they could go and stand in a line in their nearest hospital or public health center for a vaccination. And this was unheard of prior. But nevertheless, having said all these, we will be able to now to be kind of like rub our shoulders on par with some of the best in the world, because most of these technologies, Navika, come from some of the developed nations and always trickle down into the developing nations. But we have problems here in our own parts of the world, especially the developing world and parts of Asia, which are parts of Asia, Africa, of course, LATAM, and many of the other parts of the world that needs accessibility, affordability, and quality. I think we have demonstrated that. We've also went ahead and lent our products and our services and our service competencies to the other nations of the world that needed it at the time of a crisis. Yes, the pandemic has taught us a very big lesson, Navika. We cannot work in isolation. No country in this world can do that going forward. I think this is something that this is the biggest take home that I think we all should understand in bridging the possibilities, looking at challenges at a global level, transforming them into ideas and innovation and technology, and then thereby benefiting the world in terms of solutions and products or whatever the need at the time of the need when it comes up, because it's not something that we can do a knee-jerk kind of reaction after the fact that we are hit by something, which we did during the pandemic because nobody expected it, though it did kind of show a little bit in 2014 and it went away, so people kind of put it away in the back burner. But I think hereafter we need to be ahead of it in terms of technology building and platform building, partner with nations and work with groups, multiple groups if required. And we have set examples. India has developed its own rotavirus vaccine by collaborating with more than 20 different collaborating countries and institutions of excellence from across the world. We have done the first typhoid vaccine for the world, and we have demonstrated that it stands on par with the global guidelines and global parameters of quality. And so it is just a matter of time that we need to enforce and become more efficient, robust, scale, and of course also ensure that our own resources, the human resources, understand the huge opportunity that lies in front of us in order to service ourselves as a country and also the rest of the globe, if required.
Well, that's very well put, Ella. However, many questions that I asked you, you managed to answer them well.
I hope so.
I also want to ask you, just as you said that the COVAXIN app was such a game changer during the pandemic, and we set a lesson or two for the world, which looked at India probably, as somewhere in the initial parts of its development stage. But clearly we showed our prowess there, and the Prime Minister has often emphasized the fact that digital is the way to provide healthcare and to make the healthcare available to all. We need our digital and technological programs. The other part that the Prime Minister has often talked about is women at the forefront, and that happens to be an important issue at the G20. Women at the forefront, and you've been a votary of women coming into the sciences and taking technology forward. We've seen, project teams leading the Chandrayaan mission also composed of women. Where do you think the women conversation, the women piece in this G20 fits in? And what is the signaling for women in India?
Navika, our interventions in terms of digitalization will be more in terms of where, when we use them for services, for serving the entire population that we have, for understanding the challenges that we have at the field level, for compiling data. When we had to kind of like jump into the well in order to develop a COVID vaccine, we were looking at data points of about 40,000 human volunteers from across the country. And this kind of data is not easy to be done manually or physically by a few people sitting somewhere in some part of the country. Whereas all this kind of information is pulled together, it is data managed, it is correlated, consolidated, and then corroborated, and then also submitted on par with international standards and requirements which have to be also met. So digitalization, of course, is the only way forward when we have to present scientific, accurate, and systematic data, which is brought in from the innovations or the product development that happens. And this was very well demonstrated for us in terms of many ways through the COVAXIN app when it came to distribution of vaccines and other medical inputs, and also in when the vaccines had to be done. Apart from that, I think, but physically for us, we need to develop products. Product development comes from skill set and the technological information and the platforms that these young generation of children who are coming and joining us at our workforces, they also have to be trained in their skills, because product development does not happen sitting in front of a monitor or in front of a laptop. It is physically done in laboratories. The data is translated, and then, of course, a lot of steps take place in terms of animal studies and safety and all that, which then gets approved and regulated, and then we go for product development. So that is the physical part of it, which is a very laborious, long-drawn process. But in this whole journey, in the knowledge-driven sector, which predominantly is now the information technology and the biotech, life sciences, pharmaceutical sector, the medical and health sectors. I think in the health sector, we have already proved in India the numbers, the percentage of women that are in the health systems. I mean, there is no doubt in terms of the expertise that we have, in terms of our doctors and the paramedical staff that we have servicing the healthcare system. When it came to our sector in specific, I would like to tell you that we have about close to 300 to 400 women ourselves in a medium organization when we are working on molecules of this nature. So it goes to show that technology building, knowledge building, product building, clinical research, data management, discovery, all these things, even manufacturing. We have some of the critical departments in manufacturing which run 24/7, led by women in our own organization. They are managers, they are product heads, and they stand there 8 hours a day or 10 hours a day, ensuring that that product and that process that is going in front of them is completely handled by them with a couple of hundred people working under them. So there is no question at all that we as a nation have to understand that we have 500 million plus women in this country. This is my pet line always. And I think that these are great times and great opportunities that we have as a nation, that we try to at least garner a percentage of it. I'm not saying that all the 500 million women of India can come and be in the workforce, but whatever is the best of talent and the best of training and skilling that we could give them, we need to bring them on board so that they can contribute to this technological revolution. And I have heard you say that we have missed the bus in the past. Maybe we did, yes. But in this time around, with technology being the main platform for us to exhibit our skills, and we are a knowledge-driven economy, I think that goes from our past history, which is very, very clearly seen. And we can definitely ensure and bring about these capabilities in the areas of STEM, bringing women on to these kinds of roles, giving them the opportunities and the platforms to excel themselves. Yes, Chandrayaan, there can't be a better example, I think, than Chandrayaan. When we see all those women, when they stood up in ISRO, I mean, we all had goosebumps. I mean, I don't think any one of us can deny that. And so goes the same thing for us in the sciences as well. And I think knowledge is not gender, it's not, I don't think it's limited by gender. I think knowledge is pretty neutral. Entrepreneurship is pretty gender neutral. And I think the young generation of this country need to take this strong message and look into the areas of their contributions and how they could add their own excellence in these fields of science and technology, innovation and product building, and thereby taking India to the next levels of growth that we are yet to see.
Well, says one huge woman icon, leader, what can I call you? Ms. Suchitra Ella, as always, you set an example. You are a trailblazer, and wonderful and fascinating to talk to you and hear your views and how women and Atmanirbharta together are powering India into the orbit for the next big leap that we need to make. Thank you very much for joining me on the show.